Medicare Part B is really the most important part of Medicare, and it's the part of Medicare where I see people make the biggest and most costly mistakes. So today I'm going to break down how Medicare Part B works, the biggest mistakes that I see surrounding Medicare Part B, what Part B costs, which can be dependent upon your income, what it covers, and what it doesn't cover. And I'll talk about who should get Part B and who should actually delay Part B. So if you are turning 65 or approaching retirement, this is a very important video to watch, so stay tuned. Medicare Part B is available to people ages 65 and over and certain people under 65 with disabilities. This important part of Medicare is often referred to as your doctor or your medical insurance coverage, and along with Medicare Part A, it makes up traditional Medicare or original Medicare. Now, everyone is eligible for Medicare on the first day of the month that they turn 65 generally, but that doesn't mean that everyone should enroll in Medicare when they're turning 65. So most people, yes, they will want to enroll in both Medicare Parts A and Medicare Part B during their 7-month initial enrollment period window. You get 7 months surrounding your 65th birth month to enroll in Medicare Parts A and B, and if you miss this enrollment window, you may be penalized later on. However, if you're still working past age 65, then it's very likely that you may want to actually delay your Medicare Part B enrollment until you retire. So one thing that people don't realize about Medicare Part B is that it isn't free. Now, Medicare Part A, your hospital insurance coverage, that's generally free for most people, but most people will have to pay a monthly premium to be enrolled in Medicare Part B, and that premium can change over time. This year, the premium is $185 per month. That's the standard Part B premium. However, if you are considered a high income earner, then you could be paying more for your Medicare Part B premium. So the chart on the screen right now shows the income related monthly adjusted amount for Medicare Part B. This is also known as IRMA. And Medicare actually looks back at your adjusted gross income from 2 years prior. And that's how they determine what your Part B premium will be for the current year. So if you have a high income, or even if you just have a high income year, then you could be hit with these IRMA charges. Now, there is a way to appeal IRMA. I've linked the appeals form below. So if you have had a life change, let's say you retired, you're no longer working, you're no longer making the income that you used to, or you got divorced or widowed, then you can appeal these IRMA charges. Now, many people who are still working past age 65 will go ahead and apply for Medicare Parts A and B, even if they're still working and they have employer health insurance coverage that they like and is affordable and they plan to keep. But I advise against this. You see, Medicare and employer insurance generally doesn't coordinate benefits together very well. So if you have a great employer health plan and Medicare Part B, it's likely that you're paying premiums for your Part B coverage and you really can't even use it. Additionally, when you do enroll in Medicare Part B, the clock starts ticking on what's called your medigap open enrollment window. Now, this is a one-time 6-month window that everybody gets when they are new to Medicare Part B. And during the 6-month window, you can purchase a medigap policy, also known as a Medicare supplement plan, without any health questions, without any medical underwriting. You can choose any insurance company, any plan you want, and you are automatically approved. And again, this is based on your Part B start date. And in some cases, if you try to apply for medigap coverage after that one-time 6-month medigap enrollment window closes, then you could be denied coverage. It would depend on your health in most states. And if you want more information about medigap plans, how they work, which states have specific rules, I've linked all that information in the show notes below. So who should actually delay Part B and not enroll at age 65? So if the following apply, then you can and probably should delay your Medicare Part B enrollment. If you are still working and your employer has 20 or more employees and you have health insurance through your employer that you like and plan to keep, or if your spouse is still working, their employer has 20 or more employees, and you are covered as a dependent on your spouse's active employer plan, then you can delay Medicare Part B until you retire or your spouse retires, and you won't face any penalty. Now, who should not delay Medicare Part B? Who really needs to enroll right at age 65? If you have no health insurance, or if you have a marketplace or ACA affordable health care plan, you need to enroll in Medicare when you're first eligible. Additionally, if you are self-employed or you work for an employer that has fewer than 20 employees, then you should enroll in Medicare when you are first eligible, both parts A and B. Also, those covered by retiree health plans or COBRA generally need to enroll in Medicare when they are first eligible. And the Part B late enrollment penalty can be substantial. It's a 10% penalty for every 12 months that you've gone without creditable coverage. And as the Part B premium increases over time, which it can and does, that penalty also increases. So it can be very substantial. Now, how do you enroll in Medicare Part B and pay for Medicare Part B? It's a very common question we get. So if you're turning 65 and you're already collecting Social Security benefits at least 4 months before you turn 65, then the government will actually automatically enroll you in both Medicare Parts A and B, and you'll automatically receive your red, white, and blue Medicare card in the mail a few months before your 65th birth month. And they'll start taking that Part B monthly premium right out of your Social Security check every month. Now, if you're turning 65 and you are not yet collecting Social Security benefits, then you have to actively enroll in Medicare Parts A and B during that initial enrollment period 7-month window. Now, the easiest way to do this is to do it online at ssa.gov/Medicare. It's a pretty simple application. It does require you to create a Social Security Administration online account if you haven't done that yet. You'll be asked some basic questions about your identity. You'll be asked about whether or not you have employer health insurance, and you'll be asked if you want Medicare Part B. So if you select yes and then you complete the application, you'll be enrolled in Medicare Parts A and B. Now, if you select no and then you complete the application, you'll be enrolled in Medicare Part A only. So many people who are continuing to work past age 65 will go ahead and enroll in Medicare Part A only because it's free, and they will delay their Part B enrollment until they retire. You also have the option of going into your local Social Security office or enrolling by phone. If you delayed Part B because you were still working and now you're past age 65 and you want to go ahead and enroll in Part B, you can do this using your Part B special enrollment period window. You can also apply online, but there's a slightly different process. It's also at ssa.gov/Medicare, but this Part B only application requires you to upload proof that you've had prior creditable employer health coverage. The online application will let you know exactly what type of proof you need to upload, like a pay stub showing that you've had employer health coverage. You also have the option of having your employer sign the form L564, which states that you've had creditable employer coverage, and you can upload that as well. So if you're not yet collecting Social Security benefits, when you apply for Medicare Part B, Medicare is going to bill you for your Part B premiums. They're going to send you a quarterly bill. So many folks are surprised when they get that first Part B premium bill in the mail because it's several hundreds of dollars. But you want to keep in mind that it is generally a quarterly bill. And you can pay this by sending a check. You can also pay by setting up an auto pay with Medicare through the Medicare Easy Pay program, where they automatically take this monthly premium out of your checking account. Or you can log into your Medicare account and you can pay quarterly online. You can even use a credit card to pay that way, but you cannot pay over the phone. And later on, once you do start collecting Social Security benefits, Medicare will automatically take that Part B premium payment right out of your Social Security check at that time. You don't need to make any changes. So if you are getting ready to enroll in Medicare Part B, you might be wondering, what exactly does it cover? Well, Medicare Part B covers a lot. Basically, most all things that are considered medically necessary are going to be covered by Medicare Part B. So Medicare Part B covers things like doctor's office visits, lab work, diagnostic testing, physician's fees when you're in the hospital, ambulance, durable medical equipment, emergency room visits, outpatient procedures, even many non-self-administered medications, things like infusions or chemotherapy, are all covered by Medicare Part B. Now, for most services, Medicare Part B does have a deductible, meaning the amount that you have to pay first to your doctor before Medicare kicks in. Now, in 2025, the deductible is $257 per year. So the doctor or hospital will bill you the first $257 of your Part B services each year. And then once Medicare kicks in, Medicare Part B pays 80% and you're responsible for the other 20%. There are a bunch of preventative services that Medicare Part B actually covers at 100%. Even before you've met your deductible, these services would be free of charge to you. So I put a list on the screen right now that shows some of the most common preventative services that Medicare actually completely covers in full. But aside from these completely free preventative services, having to pay that full 20% of the cost for the rest of Medicare Part B covered services can be a lot. So if you do get diagnosed with cancer, 20% of the cost of chemotherapy can be outrageous. So that's why most people do consider either a medigap, Medicare supplement plan, or a Medicare Advantage plan. Once they're enrolled in Medicare Part B, either option is going to help cap your out-of-pocket exposure. Both options have their own pros and cons that are very important to weigh. So you definitely want to check out this video here, also linked below. It goes into more depth about the differences between Medicare Advantage and Medicare supplement plans, how they work with traditional Medicare, so you can decide which option's the best for you. Is there anything that Medicare Part B doesn't cover? Well, yes. Medicare Part B does not cover any services that are deemed non-medically necessary. So things like elective services, cosmetic procedures are not going to be covered by Medicare Part B. Medicare Part B does not cover most dental, vision, or hearing services, aside from in certain instances. And Medicare Part B also does not cover long-term care, also known as custodial care or nursing home care. Additionally, this one surprises many people, Medicare Part B does not cover a full annual routine physical examination. Now, Medicare Part B does cover a Medicare wellness visit or a Medicare well check, which is a real pared down kind of chat with your doctor where they take inventory of your health and help you establish a plan for monitoring your health in the future. But a full routine physical examination, which includes blood work, a full blood panel, that's generally not covered by Medicare Part B. So if you're going into your doctor for your annual well check, you want to be sure that your doctor knows how to code that properly so that you don't get any unexpected medical bills. Because if your doctor has a reason for ordering your blood work, then that would be covered. So if you're getting ready to enroll in Medicare Part B, then you definitely have some big choices ahead about how you're going to receive your Medicare coverage, what type of supplemental plans you're going to need, and what type of coverage you're going to need for prescription drugs, because Medicare Part B doesn't cover most prescription medications. That's what we can help you with here in my office. We are licensed independent insurance brokers. We work with over 30 different insurance companies. Our service is completely free of charge, and we would love the opportunity to assist. So please feel free to give us a call at any time. Thank you so much for watching. Hope this video helped to answer some of your Part B questions. We'll see you soon.